want to know if it's coming out of my paycheck. Yes or no?
Britain's National Health Service has landed right in the middle of the heated debate on how to reform American health care, with ads like this running in the U.S.
In Britain, Katie Brickell denied the Pap test that could have saved her from cervical cancer.
One of the women in the ad now says,
you know, there's lots of people in the US who would benefit from a free healthcare service.
Supporters are fighting back on Twitter, on Facebook, and on the streets.
My mum was taken ill a couple of years ago. What she got, the treatment was amazing and they saved her life. So at the end of the day, I think it's really good.
You couldn't possibly run a public health organisation of the scale of the NHS without some people being unhappy and without issues, but I thank God I live here.
Physicist Stephen Hawking said he would not be alive if it weren't for the NHS. Prime Minister Gordon Brown and his wife are using Twitter to support the system, but a member of the opposition Conservative Party trashed the NHS on American television.
You are very often just sent to the back of the queue. You turn up with a complaint, with an ailment, and you're told, okay, how about October of next year or whatever it is.
His party has criticized his words. The ruling Labour Party has pounced.
In championing the American system, they're championing good first-rate health care for those who can buy the insurance and a very poor and second-rate system for those who can't afford the insurance. We don't want that system in Britain.
So how does the NHS work? The government-run system is paid by a tax on employees and employers. With a budget of around $150 billion, it's free at the point of use. No insurance forms to fill out, no bills coming through the door. People can opt out using private insurance to pay for private doctors. The NHS buys pharmaceuticals in bulk, often at much lower prices than the U.S. Most patients pay currently just $12 per prescription, and medicine for children, retirees, the unemployed, and chronically ill is free. Ironically, the British government says one way to modernize the NHS and cut costs is to pay private American companies to provide some care. Many doctors are not happy with the idea of a private company being involved.
Where I live, a number of GP practices, primary care practices, have been given to a large American corporation, and the patients are not happy. They're horrified when they find out what's happened, and the problem with the private sector is it's in it for the money.
The World Health Organization says the U.S. spends more than twice what Britain does on health care per capita. Still, Britons have a higher life expectancy. Jim Boulden, CNN, London.